I'm Dr. Cassie from NAVC's Vetfolio and the host of Vet2Vet. Today we're talking about diabetes. And diabetes mellitus is one of the most common endocrine disorders we see in our feline patients. And for a very long time, there was really only one way we all know and love to treat it. In 2022, however, the FDA approved the first oral option for the treatment of feline diabetes. And that's Bexacat, bexaglifozin tablets. Bexacat is indicated to improve glycemic control in otherwise healthy cats with diabetes mellitus not previously treated with insulin. Before using Bexacat, you must read the entire package insert, including the boxed warning. Call 1-888-545-5973 or visit elancolabels.com/US/Bexacat for complete safety information. Joining us to talk about what could really be a huge paradigm shift in the management of diabetes is Dr. Cynthia Ward. Dr. Ward is a professor emerita of small animal internal medicine at the University of Georgia. Dr. Ward has an active research program in clinical and basic endocrinology, has authored numerous journal articles, book chapters, and research abstracts, and she's just so fun to talk to. So we're so happy to have you here with us today, Dr. Ward. Thank you for joining me.
I'm really excited to be here today and talk about this amazing drug that we have to treat feline diabetes.
Yes, this is really exciting. So let's start with Bexacat. Can you review the pharmacology and how SGLT2 inhibitors work for someone like me who's a general practitioner and maybe doesn't fully remember all of the mechanisms within the kidney?
I cannot believe you don't remember everything that has to do with the kidney, but just in case. So what's an SGLT2 inhibitor? It's a big, long name. They are sodium glucose linked. That's where the L comes from, co-transport proteins. And these are transport systems that actually help move glucose and help you reabsorb glucose back into the body from whatever lumen you want to, like the intestine and especially the kidney. So if you inhibit certain glucose transporters, sodium glucose transporters, then you can actually block glucose uptake. So the way the SGLT2 inhibitors work in the kidney are, remember that glucose is passively transferred through the glomerulus, and most of the glucose is reabsorbed in the proximal tubule of the kidney. Mostly it's reabsorbed by SGLT2 transport proteins. So very smart pharmacologists made a specific inhibitor for SGLT2 transport proteins that actually block that uptake. And so rather than reabsorbing all that glucose, you actually urinate it out into the urine.
That is fascinating. And this is an oral medication that we're giving to cats with diabetes to help lower their blood glucose level. Is that correct?
That's correct. And really what we're hoping to do with these cats is looking at a kind of a different way of treating diabetes mellitus. We've been used to using insulin as an only therapy for so long. What we can do is we can give an oral SGLT2 inhibitor, and rather than having to use an insulin mechanism of getting glucose into the cells, we can reduce their blood glucose levels by just getting them to pee it out.
Wow. So I'm thinking of a specific cat. This was probably back before Bexacat was really, going through FDA approval, who was just an absolute terror to treat with insulin. He hated glucose curves. He tried to rip off the Freestyle Libre, hated his insulin shots, didn't want to eat the food. Like it was a real challenge to manage him. And so he is like the first one that comes to mind when I think of an oral medication. Who are we looking for when we're selecting candidates for Bexacat? Who can we use Bexacat in?
So Bexacat is indicated to improve glycemic control in otherwise healthy cats with diabetes mellitus that were not previously treated with insulin. So those are going to be your perfect Bexacats. And you're right, Cassie, because not having to give an injection and giving an oral medication that these cats can eat in their food can be a real boon for the owners that just can't handle some of these tough cats.
Absolutely. And thinking of him, if he was a cat who we had already started on insulin, can we switch him to Bexacat?
So unfortunately not. Bexacat is indicated for cats that have not been previously treated with insulin. And what we're hoping to do by restricting cats that have not been on previous insulin therapy is make the drug very safe to use.
Can you go into a little bit more detail on what the risk might be for a cat who's already been on insulin?
So, for the SGLT2 inhibitors to work correctly and to work safely in a cat, the cat has to be able to produce some levels of endogenous insulin. Unfortunately, we have no way of predicting what cats these are going to be. As you know, when cats get type 2 diabetes mellitus, that's an insulin resistance type of a diabetes mellitus. And so over time, their functional beta mass decreases. So they lose healthy beta cells that just don't work anymore. And right now, we don't know what the healthy beta cell mass is in most diabetics that we see, and there's no good test for it. So to make sure that we're using Bexacat safely, what we want to do is identify the newly diagnosed diabetics that haven't been on insulin therapy, so we're more likely to pick up those cats that have plenty of beta cells that can make their own level of endogenous insulin so that we can use Bexacat safely.
That makes sense. So we're really looking for these newly diagnosed diabetics and putting them directly onto Bexacat to an oral medication.
Exactly.
Got it. So this sounds very exciting. Case in point being, my terror cat trying to manage him. But of course, it's a newer medication that, we don't have experience with yet. So that can be a little bit scary. Can you walk us through using Bexacat to manage a diabetic patient?
Oh my gosh, it's so easy. And once you try it, and I'm hoping everyone's going to try this drug, once you try it, you're going to realize that it's cutting your time in half to get them set up. So basically, what you do is you want to diagnose the cat. We want those newly diagnosed diabetics that have not been insulin treated. We need to check for ketones to make sure they're not ketotic. And if they have any concurrent disease, it should be well controlled. But you're going to take that pretty healthy diabetic cat that has no other problems, and basically you're going to start Bexacat as a once a day oral treatment. You give them one tablet once a day. You can give it with food or just give it directly in the mouth. And that's it. That's what you have to do to get going with treating a Bexacat.
Wow. I can imagine the conversations with owners when it comes to managing a diabetic cat being much easier.
Oh, it's so much easier. I mean, I'm sure as you realize, you get the diagnosis of diabetes mellitus, and then we're going to have to talk to the owners about using a needle potentially and measuring out very small amounts of insulin. And that can be a really difficult and long conversation to tell people how to do it and how to do it correctly. In this case, they have to give a tablet. They don't have to weigh the cat. As long as the cat is over 3 kilograms, the cat gets one tablet once a day, no matter what it weighs. So you don't have to check blood glucoses. You don't have to reweigh the cat. And it's very easy to use, very straightforward.
And I want to clarify one other point that you mentioned, and that's that the cat is not ketotic. So we're talking about these cats that maybe they're losing weight, they're a little bit PUPD. We run some screening blood work, and we find that high blood glucose. If we don't have a urine already included in that panel to rule out ketones, do we need to go ahead and get a urine sample at that time and make sure there's no ketones in the urine, even if this cat is otherwise, like you said, pretty healthy, eating, drinking, all of this stuff?
You know what? You want to hear the best news ever? You do not have to get a urine sample because you can
Amazing.
actually measure ketones in the blood. And so there's a very easy way to do that. You can look at beta hydroxybutyrate, which is one of the ketones that we measure, and probably the most sensitive ketone that we measure. And that's recommended for use in terms of monitoring and also screening these animals for the use of Bexacat. And you can measure that either in an outside laboratory or actually using a whole blood sample in a whole blood ketone meter.
Okay, so that sounds good, not getting a urine sample. I'm very excited about not having to poke these kitties for a urine sample. When we're talking about monitoring, though, I'm picturing the owner, and we go in and we have the conversation with the owner, and they're so happy. They just have to give a pill, one pill once a day. This is great. And then we send them out the door. They're happy. I'm probably at this point a little bit nervous, going, okay, I started this medication. How is this going to go? How am I going to monitor this kitty? I'm not monitoring blood glucose and ketones like I'm used to. I'm monitoring beta hydroxybutyrate. Is this meter something that we need to have in clinic? Is this something the owners need to have? How does the continued monitoring work, and when do we need to see them back?
So one of the things that using Bexacat is going to change our paradigm in terms of how we're going to monitor these cats with diabetes mellitus. We've all been so used to looking at glucose curves. And the other piece of good news with using Bexacat is that glucose curves really don't help you that much. So we really don't have to focus on them anymore. But we do need to measure ketones, and we need to measure ketones to make sure that we've picked the right cat for Bexacat to be used safely. So we like to get them back pretty early in their treatment to check on their ketones, like day 3 to 5. They need to come back in. We need to do a physical exam on them. We need to check their ketones to make sure they're not getting ketotic. The handheld meters are just fabulous, and I recommend them for everybody, even if you're monitoring insulin therapy in a dog or you're monitoring DKA in anybody that comes in. These handheld ketone meters are great. They take a drop of blood, and actually owners can use them at home. You can get enough blood from an ear prick to actually measure ketones. It's like using a glucometer. You get a number, you can read it out. It's very straightforward in terms of using it. So, and it does measure the beta hydroxy butyrate ketone, which is the one that is recommended for use for measuring when you're using Bexacat. So it's actually very, very easy to do. And I don't want people to get put off by new technology. It's really like using a glucometer. You just are measuring ketones instead.
I love that you said that, because I am definitely the person where you would say there's new technology involved, and I would go, nope, I don't think so. But I mean, I'm used to using a glucometer. That's something that's very easy, very familiar, something I'm comfortable even walking an owner through using. So that doesn't sound quite as scary.
It's not scary at all. And I know people are used to getting urine samples and putting them on a urine dipstick, which is certainly something that you can do to monitor for ketones. But using the handheld meters is recommended when you're monitoring Bexacat therapy. And it's probably a little bit more sensitive than looking for it in the urine. And you don't have to get a urine sample from a cat, which is a huge bonus.
Now, one term that I have heard associated with SGLT2 inhibitors is euglycemic DKA. And when I heard that, I went, oh no, now there's another disease process that I'm needing to monitor for. And in addition to DKA, and kind of like the new technology situation, my brain went, oh no, am I the best person to handle this? Can I do this? So can you walk us through euglycemic DKA, what we're looking for, and how we respond if we do see that?
So it's a term that's a little bit scary, right? And the first time I heard it, I was like, oh my goodness sakes, now what do I have to find out about this? But this is just terming it euglycemic DKA. It's just a different disease state that we really haven't seen, because you would never see it unless you use an SGLT2 inhibitor. And it's not scary. Basically what it is, it's DKA like we've always recognized it, except because these guys are on an SGLT2 inhibitor, they're normal glycemic. So they're not hyperglycemic like we would expect if we had a diabetic animal on insulin that came in ketotic. You'd expect them to be hyperglycemic. But because Bexacat and any SGLT2 inhibitor works by causing an increase in the excretion of urinary glucose, then these guys will actually have a normal blood glucose level. It's not a big deal. There are two problems that this raises. One is the name is kind of scary, but you shouldn't get scared off by the name. But the two issues it kind of raises is, one, how do you recognize it? Because you get the sick cat that comes into the clinic, you do your screening blood work, the blood glucose is normal, and I'm not sure that you're going to be thinking the animal will be ketotic, because again, we're used to insulin therapy in which if they get ketotic, they're usually hyperglycemic. So one part is recognizing it. The other part is treating it. And you can treat a euglycemic DKA the same way that you would treat any DKA that you saw in your clinic. The difference is because their blood glucose is normal, you have to supplement them with glucose as you're giving insulin. So in this case, and I think the thing to remember about treating a euglycemic DKA is you're using insulin to reverse the ketosis and not to get the blood glucose down. So we're going to reverse the ketosis with insulin like we always do, but you're going to need to supplement them with glucose because they're euglycemic and you don't want them to get hypoglycemic.
Sure. And then if we do have a patient on Bexacat who develops euglycemic DKA and we correct that, like you said, we treat it like we would treat any DKA with the supplementation of glucose as well. Is that a cat who can stay on Bexa-Cat, or do we then need to switch to insulin therapy?
So in that cat that's been ketotic, I think we have to reach for our old friend insulin, because once they get ketotic, they're probably predisposed to getting ketotic again, and they may just not be the safest patients for Bexacat.
Sure, that makes sense. And I think when I first heard euglycemic DKA, I mean, my reaction was I was a little scared of it. But when I really thought about it, any diabetic cat, any known diabetic that is being treated, whether it's with Bexacat or with insulin, when they get sick, DKA is always going to be on my radar. So knowing to go looking for those ketones. And actually, that brings up another question. When we're looking for DKA, for euglycemic DKA, also using the beta hydroxybutyrate, or are we looking in the urine at that point?
So it's recommended to look for the beta hydroxybutyrate because it's probably a little more sensitive. However, if you are in a clinic where you do not have those meters, I don't want you to not treat them, obviously, but also not use this drug, because you can monitor urine ketones. It's not recommended, but you can monitor urine ketones the same way you've always done it. So if, we like the handheld meters, they give you a number, they're probably a little more sensitive, you can follow it better. And honestly, for me, it's easier to get a little tiny blood droplet from an ear prick than it is to try to get a urine sample. But if you're used to using urines to measure ketones, or even if you use plasma or serum on a little PCV tube, to get your ketone measurements, you absolutely can do that. The most important thing is going to be looking for the ketones and making sure that you catch them. And you're right. If we're using the drug, we're probably going to have a high index of suspicion if the cat gets sick, we're going to be looking for DKA, and we're probably going to check for ketones. But the other nice thing is there's a lot of supportive material out there if the cat should go to an emergency clinic, and maybe that emergency clinic, this cat is not a regular patient, obviously, and maybe they're not familiar with the drug. There's a lot of support material out there for these veterinarians so they can look up very quickly how to treat these cases and also to understand what they are.
That is excellent news. And, you got to love the use of technology in that case, that it's all right there at our fingertips. So if we do run into these cases, hopefully that would kind of take the edge off a little bit, where we could say, okay, now let's go through this step by step and manage this similarly to how we would manage any other DKA case.
Right. And that's exactly what it is. It's like you would manage anybody else. You're just going to have to supplement glucose.
And, maybe for my own clarification here, but hopefully this can be helpful to others listening. When we're measuring that beta hydroxybutyrate and we're worried about euglycemic DKA, I'm assuming this would probably be part of the support material as well, but we're looking for it to get to a certain number, and at that point we go, this is not normal, and this is what we're dealing with?
Yeah, and I think that we're going to find these numbers get refined over time, because people are really starting to look at this because really of the SGLT2 inhibitors coming out, and our paradigm shift from looking at glucose curves to now focusing on ketones. I think there's going to be a lot more information coming out about this handheld meter and what the numbers mean. But I like those meters because you can actually trend these cats. So you're going to be getting these cats back in, or the owners are going to be monitoring ketones at home. And if you had a cat, and they usually run somewhere around 0.1 to 0.2, and if you had a cat that all of a sudden is now up at 1, even though that's not like the danger zone, I would be worried because it had gone up. And that's probably one cat I would monitor more frequently than I might normally. So again, it's one of the nice things about having the meters that actually give you a number.
Yeah, that does seem like a huge advantage of being able to say, okay, we might start to get into trouble here in a way that, it doesn't involve glucose curves and visits to the hospital over and over again and things like that.
And I guess the other thing that I want to say about euglycemic DKA, we talk a lot about it because it's new and it's kind of a scary new name. And so there's a lot of attention paid to it. And I want to point out this is pretty rare. It doesn't happen very often. Less than 5% of these cats are going to develop this, which is actually less than what we see with insulin therapy. So I don't want people to feel like this is going to be something that is going to happen in a ton of cats that you treat. It won't. It's a pretty rare occurrence.
I'm so glad that you brought that up. It wasn't even on my mind. I was kind of going, okay, any cat I put on this, we really need to be watching closely because they're going to get this scary new condition. But that's good to know that it is fairly uncommon when we're treating with this drug. One other thought that I had when we're talking about SGLT2 inhibitors is now they're urinating out all of this glucose. Are we predisposing them to UTIs? Because we know those can be quite complicated just in general, but certainly in cats.
You know what? Shockingly, no. And I was really surprised about that too, because when you first start reading about this drug class, that was exactly my thought is, oh my goodness sakes, they're going to get more urinary tract infections. But there's cats that have been studied, all had urine cultures performed, and there is no increased incidence with using this drug. And certainly we're not seeing it any more commonly than we do with insulin. So surprisingly, no, they don't.
Wow, that's really exciting because that would be, kind of a deterrent to say, oh, I don't want to give them, UTIs and then have to go back and treat with antibiotics and things like this. So to be able to use an oral medication and maybe have a little bit easier time monitoring and not increase the incidence of UTI is really exciting.
I know it's fabulous.
You mentioned support resources for veterinarians and for pet owners. What kind of support resources are available?
I think that you can find there is going to be a ton of support. And I think that's been driven by those of us who've been lucky enough to be into the diabetic field for so long. I am so excited about this drug coming out on the market, mainly because we've euthanized so many cats because owners can't keep up with this complicated therapy that we've asked them to do. And now we have something that they can give orally, which for many people is so much more approachable and also is reasonably safe because they really don't get hypoglycemic on it. And I think many of us have been pushing for the companies to actually put out a lot of supportive materials in terms of helping people get these cats set up and then helping them monitor these cats. I know that there is a slew of literature that's available on the Bexacat website, and also I'm sure from all the reps that sell Bexacat that will really help people walk through this process. There are a lot of resources that are available for first-time Bexacat users. There is a whole 2-page detailer. One side will tell you how to screen and pick the appropriate cat to be a Bexacat. And on the other side, there is a whole detailer about how to monitor, taking you step by step, what exactly you need to do to monitor these cats when you start them on Bexacat. The other really cool thing is there's actually this really pretty sticker that you can put on a cat carrier so that when the cat goes to maybe an emergency clinic or maybe another clinic that is not their regular clinic and they're seeing a new veterinarian, it can identify them as a cat on this medication. And it's really nice. It's got a QR code on there, and the veterinarian can just then pull up all the information about this drug, what to look for, how to monitor. So they'll have all the information at their fingertips. So there's a lot of resources out there to take away any sort of fear people might have about using a new drug, because it is really, truly exciting. I mean, we're just going to save so many lives with this drug. And I think all of us are very excited that to make it as usable as possible for somebody that doesn't spend their whole day thinking about diabetes.
I think all of us spend a fair bit of time thinking about diabetes. But no, that is really, really wonderful because this is a big paradigm shift, I think, for all of us. And so having that support, having the experts there to kind of hold our hand and walk us through it is going to be critical as we make this shift and kind of get used to this and find our feet in using it more commonly.
Yep.
So with that in mind, what's something you wish that all veterinarians knew about Bexacat?
There are two things. Well, actually, there's three. Can I say three things?
Of course. Yeah, I want to hear them all.
One is, I think it's a life-saving drug, and I want to encourage everybody to try this drug. Pick your next newly diagnosed diabetic that's not ketotic and otherwise healthy, and just try this drug because I think you're going to love it. The second thing I want people to know is that it's so much easier because you don't have to worry. You don't have to warn owners about hypoglycemia. They really don't get hypoglycemic. You also don't have to instruct owners about a strict feeding schedule because it doesn't matter when they feed these cats in relation to them getting this medication. So it not only it saves so much time in the exam room, and I think people are just going to be excited about how approachable this drug is to use. And I'm just hoping that people will, so that really we don't have to euthanize diabetic cats.
Absolutely. Well, Dr. Ward, I really appreciate you joining me today. You've taken some of the novelty and some of the scary parts of making a whole paradigm shift and using a new class of drugs. You made it a little bit more approachable, a little bit less scary for all of us. So thank you so much for all of the information. I'm really excited to get going and try this out. And like you said, save some lives with this, because certainly I'm with you. I think we euthanize far too many cats with diabetes. So having another option is just going to be life-changing for all of us.
Well, thank you. It's always so much fun. So thanks for having me.
And thank you to Elanco for partnering with us for this edition of Vet2Vet. Check out navcsvetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day. Important safety information. Before using Bexacat, you must read the entire package insert, including the boxed warning. Call 1-888-545-5973 or visit elancolabels.com/US/Bexacat for complete safety information. Cats treated with Bexacat may be at an increased risk of diabetic ketoacidosis or euglycemic diabetic ketoacidosis, both of which may result in death. Development of these conditions should be treated promptly, including insulin administration and discontinuation of Bexacat. Do not use Bexacat in cats with diabetes mellitus who have previously been treated with insulin, who are receiving insulin, or in cats with insulin-dependent diabetes mellitus. The use of Bexacat in cats with insulin-dependent diabetes mellitus, or the withdrawal of insulin and initiation of Bexacat, is associated with an increased risk of diabetic ketoacidosis or euglycemic diabetic ketoacidosis and death. Sudden onset of hyporexia, anorexia, lethargy, dehydration, diarrhea that is unresponsive to conventional therapy, or weight loss in cats receiving Bexacat should prompt immediate discontinuation of Bexacat and assessment for diabetic ketoacidosis, regardless of blood glucose level. Bexacat should not be initiated in cats with pancreatitis, anorexia, dehydration, or lethargy at the time of diagnosis of diabetes mellitus, as it may indicate the presence of other concurrent diseases and increase the risk of diabetic ketoacidosis. Due to risk of severe adverse reactions, do not use Bexacat in cats with evidence of hepatic disease or reduced renal function. Consult a physician in case of accidental ingestion by humans. Bexacat is a trademark of Elanco or its affiliates. Copyright 2023 Elanco or its affiliates. PM-US-23-1808.